Vanakkam, good morning. In this video, we are going to discuss about the II ECG, II electrocardiogram. This is the most frequently asked short notes from the cardiovascular system physiology. The II ECG, x-axis depicts the time in seconds, y-axis depicts the amplitude. It is the large square. The large square duration is 0.2 second. Amplitude is 0.5 millivolts. Duration of the small square is 0.04 second. Duration of the one small square amplitude is 0.1 millivolts. You have to remember this point. The waves, these have P, Q, R, S, T waves. P wave is due to the atrial depolarization. Atrial depolarization produces the P wave. Duration of the P wave is the 0.1 second. It can occupy the more than 2 small square. Amplitude is 0.1 to 0.112 millivolts. Amplitude also occupy the more than one small square. So P wave is due to the atrial depolarization. Atrial repolarization we cannot see separately. It is merged with the QRS complex. The QRS complex is mainly due to the ventricular depolarization. Ventricular depolarization. The duration of the QRS complex is 0.08 to 0.10 second. So it can occupy the 2.5 small square duration. Amplitude is Q wave amplitude. Normally we cannot see the Q wave. So old MI only we can see the Q wave. It is very less amplitude. Negative side 0.1 to 0.2 millivolts. Very small deflection in the Q wave. R wave, it has a larger amplitude. It is 1 millivolts. 1 millivolts amplitude. S wave is negative deflection around 0.4 millivolt. 0.4 millivolts. So this is the QRS complex. It is due to the ventricular depolarization. The T wave is due to the ventricular repolarization. The duration of the T wave is 0.2 second. 0.2 second. It can occupy the one large square. Amplitude is 0.3 millivolts. It can occupy the 3 small square height. Normally we cannot see the U wave. U wave is mainly due to the repolarization of the papillary muscles. Sometimes in hypokalemia we can see the U wave. So P wave is due to the atrial depolarization. QRS complex is due to the ventricular depolarization. T wave is ventricular repolarization. We cannot see the atrial repolarization. It is merged with the QRS complex. The PR interval is onset of the P wave to the onset of the QRS complex. This depicts the atrial depolarization and conduction of the impulse through the AV node. Normal duration of the PR interval is the 0.18 second. PR interval is prolonged in AV nodal delay. QT interval is the onset of the Q wave to the end of the T wave. So it depicts the ventricular depolarization and ventricular repolarization. The duration of the QT interval is 0.4 to 0.2 42 seconds. It depicts the ventricular muscle activity. RR interval is the duration of the one cardiac cycle. So time between the two successive R wave is the RR interval. The time duration is the 0.8 second. ST segment is the isoelectric line. It is the flat line. Okay. Isoelectric point. It is elevated in the myocardial infarction. The J point is the starting point of the ST segment. The end of the QRS complex and the beginning of the ST segment is the J point. J point is elevated in the myocardial infarction. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribed this channel, please subscribe. Thank you once again.